It first became known in January this year when we were reviewing some data with the AJAX trial, and that is designed precisely to see how beneficial screening is for the older and younger age group of women. And we've been working on that solidly since then. It's a hugely complex data system, and we've trawled right back to 2009 and have fixed anything to make sure that it can't happen for women again.
But if it was known in January, why are we not hearing about it until May?
So we have had a clinical advisory group running alongside our investigation, and we have been looking to ensure that a group of women who clearly from the stories will be anxious about this are treated very sensitively. Their advice has been that we should have everything in place. Yeah. And so alongside our investigation, we have been looking at what should be offered to them, what's the right thing clinically, and to ensure that all systems are in place to support them.
Respectfully, that may be an answer to a question. It's not the answer to my question, which was, this became known in January. We're not hearing about it until May. Why?
So I think just going back there, our expert advisory group were very clear with us that this should not be communicated to women until we were very clear of the totality of the problem, and that all systems were in place to treat them sensitively and manage their concerns at the point that it was announced.
And this was discovered because of an IT upgrade, is that correct?
That's right. In fact...
so is it fair to say then, had we not had that IT upgrade, it could have gone on even longer, or might never have been detected?
It's a very difficult and diffuse system, and so obviously we respond and we review our systems. There's a strong quality assurance process, but this particular one of seeing the ages of the totality of the women in the programme has only become possible since that upgrade came into place.
But when the Health Secretary says for many years oversight of the programme has not been good enough, that speaks directly to the work that you and your colleagues do at Public Health England. You've failed here, haven't you?
Well, Public Health England obviously takes this very seriously, and along with...
I'm glad you do, but you accept you failed here, don't you?
We have, we're hoping to, obviously we've put right...
Sorry, what's the problem with the word you failed, Jenny Harris? You accept you failed here?
Clearly we're very sorry for what has happened, and it is a system that we provide along with colleagues in NHS England, Department of Health and NHS Digital.
You accept there has been a failure here, though, don't you?
There has been a failure, and we're all sorry for that across the system.
All right. Lastly, obviously my listeners who may be caught up in this, when is the timeline? When will this issue be resolved? And will we ever know how many people might have been affected, might have lost their lives as a result?
So clearly, the people who are affected are obviously at the forethought of our planning. And so all those women who have been affected, who are registered with the GP, will be written to by the end of May. There is a helpline running for them now, and anyone who wants a screen will be able to have one by the end of October.
Will we ever know the number of women who lost their lives as a result of this?
So, yes,
we will.
It's very difficult, as you know, that is modelled data because each individual patient's circumstances are very different. But when women come through, they will be able to have a review of their own individual circumstances, and then it will be much clearer to see what, if any, this invitation myth impact that has had on their own individual circumstances.